What to expect from a drug or alcohol assessment? Well, it actually depends on who's asking this question. So the number one problem I have with assessments is the honesty of information being fed into the assessment. I can't tell you how many times we have done an assessment with a family prior to an intervention, and there was without question a severe diagnosis of a substance use disorder, only for the person to go to treatment and the treatment center say, I can't even admit this person. They're telling me they don't drink or drug, or when they do, it's very minimal. So what to expect from a drug or alcohol system all depends on the honesty of the person being assessed. Because when we do drug and alcohol assessments, we look at family history, we look at medical, we look at mental health. We also look at drug and alcohol consumption and date of last use and whether or not somebody's experienced withdrawal symptoms. And there's a lot more things involved with that. So if there's one thing I've learned as an interventionist and working in treatment, the assessment data that we receive, honestly, from a family is always far superior to any assessment data we receive from a substance user who either is dishonest when they do the assessment or largely in part omits information. Should the substance user be honest, what you can expect is an appropriate level of care assignment and a treatment plan that's originally put together, and deciding whether or not the person needs detox for alcohol and drugs. And then, of course, they're admitted into that level of care. And then that assessment is always ongoing. Everybody thinks, or I shouldn't say everybody thinks, many people are under the impression that an assessment happens one time. And that may be true on paper at admissions, but assessments are always ongoing in treatment. Sometimes people backslide, sometimes people improve. So it all depends on where that person's at. But an integrated treatment team is always going to be assessing the client all the time, every day, everywhere. And I can't stress enough, I am repeating myself, is that assessments are only as good as the data that goes into it. And if there's dishonesty and omission, don't expect much.